acknowledge the news that has broken today on the very sad death of His Royal Highness Prince Philip. And therefore, as a mark of respect, we would ask that everybody turn their camera off and join us for a minute's silence before this press conference begins. So if I can ask our panel just to turn off their videos. Thank you very much, and we'll just take a minute's contemplation. Thank you. Thank you. I appreciate your support in that. As I said, it's only right and proper for us to begin today in light of that news with a minute's silence to pay our respects. So back to our business as usual from a point of view of an update on the local COVID-19 situation. I welcome you all. I'm Lucy Whiteman, Director of Public Health, for those that haven't joined us before. And today on the panel, I'm joined by Dr. Rosalind Harris, who is one of my consultants in public health for both of the Northamptonshire councils, by Mr. Chris Pallow, who's the Programme Director for the COVID-19 vaccination programme in Northamptonshire, by Eileen Doyle, who is the Chief Executive Officer of Northampton General Hospital, Dr. Joanne Watt, who was one of our local GPs and obviously representative.
Take your hands on your knees and do a little jump back. Stick your bum out.
Thank you. And is also the clinical chair of the Northamptonshire CCG. We have got apologies from Assistant Chief Constable Simon Blatchley, who's been called away obviously on business with regard to the announcement earlier today. But we're lucky enough to also have with us Mike Deacon, who is an environmental health officer in the county, and also the operation commander for the Corby testing pilot that we will be discussing as part of today's update. So without further ado, if I can hand over to Dr. Harris, just to give us an update on the most recent surveillance report, please.
Lucy, and if we can share the slides on the screen, I'll be referring to the surveillance pack that shows data up to the 4th of April. And if we can head straight to the third slide, slide 3, and start with just an update on some of the changes that are expected on Monday, 12th of April. I'm sure you'll all be familiar with, but just to run over some of these again. So essentially, there'll be reopening of non-essential retail, close personal services, so hairdressers, nail salons, and outdoor table service, hospitality, as well as opening of gyms and indoor swimming pools, and zoos and theme parks. In terms of sort of travel and overnight stays, so travel should still be kept to a minimum, and there should be no household overnight stays, but households may stay over in self-contained accommodation, so campsites or self-catering accommodation will be allowed. Again, travel is still recommended to be kept to a minimum, so if that's possible to do locally, that's the best that we can recommend. In terms of socialising more broadly or meeting others, outdoor meetings are permissible still, and nothing's changed there in terms of the rule of 6 or 2 households meeting outdoors, either in a private garden or a public space. And then finally, in terms of life events, the change to notice with funerals that now wakes will be possible for up to 15 people, but in approved settings only. And similarly, weddings are now possible with 15 people attending, weddings or civil partnerships. If we can move straight on, just to give a quick reminder on slide 4 to our campaign around take care in the open air. So one of our key messages is, even though we can meet with 5 other people outdoors, it's really important that we still do take care. We know that the risks are reduced if we're meeting outdoors in the open air, but that doesn't mean that we shouldn't be sort of relaxing any of those measures in terms of social distancing. We absolutely shouldn't be hugging people from other households that aren't in our household bubble. So we still need to keep a distance, make sure that we're cleaning our hands and wearing face coverings as appropriate. And there's some advice on those assets that we've created, the communications assets around how we can be a bit safer in the open air. Moving on to slide 5, the other key message, I guess, as different sectors start to open up is to remind everyone about the availability of testing, and that's something we'll come to shortly, is the announcement made by the Prime Minister over this weekend that free rapid LFT, lateral flow device testing, is now available for all adults in the country, twice weekly testing, and it's available from a number of different routes. You can either come to one of our local testing sites, and they're all listed there and available, details available on our councils, both councils' websites. That's one option. The second option is to take part in a sort of click and collect model. So click and collect sites. You don't actually have to book a slot. You can just collect test kits. However, all the details are available online of where those collection sites are available. It's various test sites, but also pharmacies across the county. And as I say, details of these are available on our website. You can click a link that shows you a map of all the collect sites. You can collect some home testing kits. And then finally, there's an option for home delivery of home testing kits as well. So again, through our website, you can order a delivery of a pack of 7 test kits for your twice weekly testing. So I guess the message there is lots of different options for how you can access these tests, and that's on top of some places or some people might be already being offered testing at their workplace. If you're getting tests at your workplace, please do continue with that. We're not asking people to change their method of testing, but however you do it, please do get tested twice weekly. Clearly, it's most important for those people who are out and about and mixing more. It's eligible for everyone, but if you are in one of those groups that aren't able to work from home or are soon to be working from the 12th of April in any one of those settings that are now open, it's these people that we're really keen to ensure that they're getting regularly tested. And that moves on to slide 6, just to reiterate some of those messages that I've just talked about. So first of all, while there has been, or there will be from Monday onwards, a relaxation of some of those restrictions, the key thing is to ensure that relaxation of restrictions happens safely, is to make sure that we do things properly. So we do need to continue social distancing. If we are attending an outdoor site for a meal, or we're meeting in gardens with other people to enjoy a meal together, we really do need to make sure that we're continuing to socially distance, cleaning and sanitising our hands properly, and if it's appropriate, wearing face coverings, and doing everything that we can to make that make that interaction safe. I think that will be the key thing. It's not necessarily the opening up of these services is where the risk lies. It's more in how people do that. And then, as I said, the other key message around regular testing. So I know that the Prime Minister over the bank holiday weekend made this clear, but these asymptomatic testing, these lateral flow tests are being made available to all adults. It's really important that people understand that even if you don't feel ill, there is a chance that you still might be infected or infectious with coronavirus. So we think that around 1 in 3 people who are infectious don't display any symptoms, and that's why we want as many people to get asymptomatic testing as regularly as possible, so that we can pick up really quickly those that are infectious, make sure they isolate, and we can prevent that onward transmission. We can break the chain of transmission. Slide 7, I will not go over in detail because I know that Mike's going to give an update on our Corby door-to-door testing pilot. So if I can head straight on to slide 9 and run through the data. So some positive news this week in that for the week between the 29th of March and 4th of April, we had 402 new cases of coronavirus identified in the county. We've seen a sort of a plateau picture since the beginning of March in terms of our case numbers. And last week saw a 30% reduction in cases. So that's something to be positive about, and something that we need to keep going with as these restrictions ease. That's an indication that people are taking all these measures, are taking up testing, are getting vaccinated, and are maintaining that those measures, social distancing, hand washing and face coverings. If we move on to slide 10, that will show the picture across the 2 unitary authorities and county-wide. So county-wide up to the 1st of April, in that week, there were 64.8 cases of coronavirus per 100,000 population. And that compares to a national rate of 42. So that the split across the county, when we see Northamptonshire's rate, 86.4, is significantly higher than the England rate. And at West Northamptonshire, 46.2 per 100,000, similar to the England rate. And that difference is mainly driven by rates in Corby being much higher than in other areas, but there are other areas of Northants that do have higher than the England average rate. So each of East Northants, Kettering and Wellingborough do have higher rates, significantly higher rates than the national average. I won't get into the details of the actual numbers of cases. I'm sure this slide set is going to be shared. So I'd like to move on directly to slide 13, just to see a visualisation of how those trends across the district and boroughs have played out over the last weeks and months, just to show that some positive news that although Corby rates are still the highest in the country, they do appear to be coming down over the last few days, which is encouraging. If we can move to slide 14 to show cases by age and gender. So this picture has changed in recent weeks and has changed a bit more slowly to the national picture. So we know that case rates in our 10 to 19-year-olds or 10 to 16-year-olds, specifically nationally, were at the highest age group in terms of cases last week. Sorry, and the week before last. At that point, the week before last, we in Northamptonshire were still seeing that peak in the 30 to 39-year-old group. We're now seeing a picture where our cases in this younger age group are similar to that of the 30 to 39-year-old group. We know that we're doing more testing in these age groups. So part of that increase is undoubtedly going to be the fact that we are actively seeking out cases and case finding in that group. But that's not to say that we don't need to keep a very close eye on that and make sure that that cohort of young people are being as safe as they can, particularly over the Easter holidays. Just 3 more slides that I wanted to run through. Firstly, slide 15, looking at hospital bed occupation, to say that even though we've seen a plateau in case rates, we're continuing to see a reduction in hospital beds occupied by COVID positive patients, with latest data showing 40 patients in either KGH or NGH up to the 6th of April. And then slide 16 to show a really positive picture in that we've had no deaths in the week up to the 4th of April and are continuing to see that picture. So despite cases plateauing, we've seen a continuation of reduction in deaths, indicating how successful our vaccination programme has been. And then finally, slide 21, to show a summary of outbreaks. And I guess the key message from this slide is that our outbreak figures have reduced considerably. So we were at one point looking at in the hundreds of cases that were associated with outbreaks. We're now down to 26 cases that are associated with 6 outbreaks in this last period, which again a positive note to end on. And if I can hand back to Lucy and take any questions as directed.
Thank you. We'll move on, if that's okay, to Chris Pellow to give us an update on the vaccination programme in Northamptonshire, please. Thank you, Chris.
Thank you, Lucy. So good afternoon, everybody. The latest position that's been publicised for Northamptonshire is that a total number of 407,000 doses have been given. 347,000 of those were first doses. We continue to make good progress through the cohorts, with 98% of over 80s, 100% of 75s, 97% of 70s, and continuing down through the cohorts with good performance to the age 50 cohort, where 88% of people have been vaccinated. So a key message for me is that you are in the age group of over 50s. There are appointments for you to be able to access. You can do so by calling 119 or going to the NHS website and booking an appointment for a vaccination where we have capacity to be able to do that for you. We continue to vaccinate at the vaccination centre at Malton Park and through our colleagues in primary care who are focusing very heavily on second doses at the current time, and also through our 2 hospital hubs. There are some key messages that I would like to give specifically around some questions in relation to Corby and of course the relaxation, which is of course that if you've had your first vaccination, firstly, please do continue to carry out the same precautions that we have publicised throughout this programme, and of course attend for your second appointment when your GP calls or when you have made that for the vaccination centre. It is critically important that every member of our community that's had their first vaccination remembers to come forward for their second, because of course that offers them the very highest level of protection for you. So brief update from me today. Thank you. I'll hand back to Lucy.
Very much, Chris. Eileen, would you like to give us an update on the position in the acutes, please?
Thank you, Lucy. So slightly more recent data, actually, because I've just got it hot off the press. So we now have 29 patients across both hospitals with a COVID positive diagnosis. So that has come down even in the last couple of days since we heard the previous speaker. So all going in the right direction, but what I would say is we're incredibly busy, and that's busy full of patients who've got things that they need urgent care for. We've got patients that we're trying to get through in terms of delays, treatment delays that might have occurred throughout the last few months or so. So we are really, really full. So if I was to give any, one plea really, please continue to be careful, because actually, if we see any of our behaviours mean an increase in hospital admissions, we really will be struggling again. So fantastic effort by everybody for sticking to the rules, because there's no doubt that, the numbers are irrefutable, but we could so easily lose it yet. And at the moment, we're trying really hard in both hospitals actually to make sure that we're treating everybody that needs it. And we need to keep those COVID numbers down. There have been some questions around our vaccination hubs at both sites, and they are winding down now, because they were, if you remember, they were originally set up to give the vaccination doses for hospital staff, dentists, some of our other healthcare colleagues, social services and so forth. So they were never set up to be vaccination centres in the way that Chris talks about. So now that we've done the first and second doses, both of those facilities will be taken down. There's more than enough capacity across the county. We've heard some tremendous numbers. So, but obviously it was a big undertaking for both hospitals, and those are staff that have come out of other areas to go and man those facilities. So we will be taking those down. KGH goes back to normal, if you like, from the 15th of April, and NGH is the end of the month. But worry not, there is still plenty of opportunity to get to vaccinations, and but for it's done its job, if you like. So that's why that's happening. So as I said, a real plea: please be careful. We've done so well. If you're feeling unwell, don't come into hospital. We really want to be able to move freely, our patients to be able to have visitors and all that kind of thing. And that just takes much longer the more infection that's out there. So positive news from the hospitals, but we're crossing fingers and toes. Thanks, Lucy.
Thank you, Eileen. And Mike, would really like to welcome you to give us a bit of a briefing about the activity that's going to be happening over the weekend, please, with the Corby testing pilots.
Thanks, Lucy. Good afternoon, everybody. If I could just give you some brief outline as to what's going to be happening in particular in the Beanfield estate in Corby over the weekend. We aim to undertake a targeted door-to-door community testing exercise. Each house on the Beanfield estate will be offered testing kits with a view to hopefully reducing case and transmission rates prior to the easing of national restrictions. This pilot exercise will also provide Northamptonshire Council with an opportunity to test surge capacity plans, which it was required to draft earlier this year, and which you may recall we were required to put in place to address spikes in cases or the development of variants in localities. Beanfield has been identified as the location for the pilot, as it is an area with high case rates and low rates of testing. The exercise itself has been organised by the public health team at Northamptonshire Council. Trained volunteers will be knocking on all household doors between 10 and 4 on Saturday and Sunday, talking to residents about coronavirus and offering free testing options regardless of whether the household or occupants of the household have symptoms or not. Depending on what comes from those conversations, households will be offered either a PCR test or a rapid lateral flow test kit. Again, that will be dependent on whether symptoms, whether the household has people with symptoms or not. All the volunteers involved in the exercise will carry clear ID and wear PPE to ensure not only their safety but the safety of the communities that we are visiting. They'll also be adorned in high visibility jackets. As I said, each household will be visited, and where PCR test kits are left, arrangements will be put in place to visit those properties later in the day to collect those test kits. If lateral flow test kits are left, there isn't a requirement to collect those kits, but there'll be instructions in the test kits for the households to report the results of those tests within the household. And each of the kits will have information on how to carry out the tests within them. Lucy, hopefully that provides a brief outline of what we're trying to do this weekend.
No, that's brilliant. Thank you. And I think just take the opportunity to obviously reinforce the fact that we're all really excited about moving to the next step of the roadmap. You know, we recognise that lockdown and the restrictions have been very difficult on people. It's impacting on the economy, it's impacting on people's physical health, it's impacting on people's mental health. We want to continue to progress forward. But it is key. The government has outlined 4 tests that must be met. And, you know, Eileen's already touched on one. One is making sure that obviously infection rates do not risk a surge in hospitalisations or mortality again. You know, we're on a right trajectory for that to obviously continue positively at the moment. We still have evidence that the vaccination uptake is good locally and that those vaccines are effective. So again, we've got a positive news story there. Despite Corby having higher rates, you know, we are still meeting that test requirement. The vaccine deployment programme, as I said, is very successful. We are still urging people to take up that offer when it comes, and if they think they've missed it, to make sure that they contact the 111 number to see if they're eligible and book again. But one of the things, as Mike's just touched on, is we also need to make sure that we don't have a variant of concern in Northamptonshire that could obviously see a significant and steep rise in cases that may also not necessarily be effective with the vaccine. So our being able to surge test our plans is really important, and we're trying to sort of kill 2 birds with 1 stone here in Corby by supporting residents where they've had high case rates to get tested, and obviously then to support them to isolate if they're required to do so. But as Mike said, it really gives us an opportunity to in real time test our surge plans should we find a variant of concern locally. So I think, you know, it's making sure that we've got all the right things in place as a set of services locally to support all of the next steps as well in the roadmap out of lockdown. So thank you all on the panel for your updates. And what I'd like to do is move on to the questions that the media have kindly submitted. So if I come to Laura Coffey, do you want to ask your questions, please?
Thank you, Lucy. So my first question, well, both questions really are to do with the testing in Beanfield. So the first one was, what happens if people refuse to go ahead with the testing? And then the second one is there any impact if you find that there are high, I mean, you've already said that there are high cases in this ward and that's why it was picked for the pilot for the testing, but is there any impact on the easing of lockdown measures if there's a significantly high rate in this ward from this testing over the weekend?
Thank you, Laura. Mike, shall I bring you in first to answer that question about participation?
Yes, there is no intention to issue any penalties or undertake any enforcement to any households that don't wish to partake in this exercise. It really is a voluntary exercise, and if a household does refuse to take part, the volunteers will just move to the next property, noting that household has refused to take part. We will also be leaving calling cards to households where we don't receive an answer, so that those households do have the opportunity to access the test kits if they need to.
Thank you. And Dr. Watt, do you mind if I bring you in here? Obviously, as a local GP, you've seen the impact of some of those high case rates in certain areas. What would you say to residents who do get a knock on the door?
So I think people in Corby are known for being extremely friendly, and I think it's really important that people are able to get back to normal and to do that safely. And as part of that, it's really important that you care for the people around you. A lot of people around here are worried about their children being able to get back to school and stay in school without classes being sent home. This is an opportunity to make sure that you are safe, to allow your children to get back to school and stay at school. And when you are mixing and socially distanced from people, to know that you're not putting those people at any additional risk. So I think Corby people will step up to this. I think we do care about our community. We care about getting back to normal. There's a huge amount of pride in the town. And I think it's about taking advantage of all of the testing opportunities that we have that allow us to get ourselves back to normal, get vaccinated, get tested. All of those things are really important, and continue that positive direction. So I think Corby people will will step up to that. I know people are frightened about testing positive, and people are worried about what that might mean. But actually, if it means that you protect the people around you, it is absolutely the right thing to be doing.
Yeah, here. Thank you, Jo. Roslyn, can I bring you in with regard to sort of next steps if we find high positivity rates?
Yeah, sure. And actually, just to follow up on Dr. Watt's point, if we actually do find a number of cases through this exercise, that's really positive for the people of Corby. So by identifying positive cases and making sure they're isolating for 10 days, we can make that reopening of the economy on Monday so much safer, and hopefully prevent any sort of outbreaks in schools, workplaces that require any schools to be closing classes, etc. So I think in terms of the impact of people taking up this test and testing positive, that there's only going to be good impact from that. In terms of impacting the easing of lockdown measures, so that is a national decision. So if we do find high positivity levels through this exercise, it will help us decide whether we want to do more door-to-door testing across the county, and speak to our national colleagues about that. It will B, help put other measures in place to support residents in that area. And I think those will be the measures that we take, rather than any kind of changes to the national picture around opening of the economy. I hope that answers the question.
Thank you very much. So if we move on to Northants Live, and Matthew Harris, have we got you on the line?
Yeah. Hi guys. So I just have one question here. It's are there specific plans in place to ensure that government COVID rules are being followed in shops, and if so, what are they?
So obviously we don't have a police representative with us today, but we do have one of our environmental health officers. So Mike, are you happy to sort of comment on some of the preparations, and then I might well bring in our comms lead as well to talk about how they've been engaging with businesses?
Yeah, happy to. What I can reassure callers on is the amount of work that's been taking place in supporting businesses to prepare for the reopening. Similarly to what has taken place following the earlier lockdowns, there's a huge amount of groundwork being done between enforcement officers, environmental health, trading standards, and police officers in liaising with businesses to prepare them for the reopening. Huge amount of questions that have been asked by businesses in terms of preparedness for compliance. What happens post the 12th? Well, again, as with previous opening up of the economy, we will monitor the situation. We will work with our colleagues across the enforcement agencies and regulatory bodies to see where the need to respond is most prevalent. Yes, the rules are there, the penalties are there, so everybody is prepared. And I think with this being the third lockdown, coming out of the third lockdown, I think there's likely to be less confusion. But equally, I think some businesses, the feedback we're getting is that some businesses are waiting. They're waiting for future steps in the roadmap in opening up their businesses, rather than undertake steps to be able to open their businesses immediately.
Thank you, Matt. That's really helpful. Kath, did you want to add anything about the work that you've been doing with some of the businesses locally as well, to give them support to ensure people are clear on what the new restrictions are?
Sure, thank you. Yeah, as Mike said, a lot of the work really is with engagement with local businesses who tend to have their own signage and instructions for customers. So much of the comms work that we've been focusing on is around the behaviour of people in those outdoor settings. As Rossi mentioned earlier, the amount of people we can meet with hasn't changed since the last announcement. So we're just reinforcing those messages in outdoor spaces. Town centres will have new signage, so you'll start to see hand space messages around town centres, and the usual markers on the floors to help people stay safe and at a safe distance. And the main things really are around those settings where people might be consuming alcohol, just remembering to keep 2 meters apart, to wear face coverings where appropriate, to keep washing hands. If you're in places where you're touching different surfaces quite a lot, to just keep up that hand hygiene. So really a lot of our messaging is just keeping safe in the outdoors. The risk is lower, but it is still there, and it's just there to provide guidance. You'll find it across the social media channels, again, of both the West and North Northampton councils, public health channels, and across the local resilience forums, and in much of the outdoor spaces across our buses and on various radio channels as well. So hopefully the message is clear.
Wonderful, thank you. And obviously we're always here as a public health team serving both of the councils should anybody have any queries or indeed require any guidance. So we're always happy to answer any questions. I know that we've already answered the vaccination question that you asked, Matt. So if you're happy, we shall move on to Alison Bagley from the Northampton Telegraph, please.
Hello, good afternoon. I don't know whether you've answered this because my laptop was glitching something horribly, but anyway, how many homes are there in the Beanfield pilot area? Just a quantity, you know, how many they've got to visit. Will you be targeting any other areas of Corby or elsewhere in the county? What difference is there between Beanfield and any other estate in Corby that might be the reason for the high case rate? And given that Corby has one of the highest, or is the highest case rate in the country, and Beanfield is being targeted, is it fair to say that the Beanfield community has the highest case rate in the country?
Thank you, Alison. So what I'll do is if I bring Mike in just to give us an update on the kind of the numbers that we're talking about over the weekend, and then I'll pass over to Dr. Harris just to give you a bit of a view about why we've chosen the particular area that we have.
Yeah, happy to, Lucy. We're hoping to visit approximately 3,300 properties over the weekend, which will cover a population of just over 9,000 people. So that's the target for the Beanfield.
Thank you. And just to reinforce, if we find a variant of concern, our surge plans are required to be able to reach out to around 10,000 individuals. So you can see, obviously, again, it's a really useful test of our resilience should we ever need to take that step. Rosin, do you want to just give us a bit of an update as to some of the variables that we consider when choosing areas?
Yeah, absolutely. So I'll begin with the last question around whether Beanfield has the highest case rates. So the quick answer to that is no. So the way we've prioritised all the wards in Corby is based on a combination of factors, including testing rate, really importantly, because we want to reach out to those communities that aren't getting tested and explore maybe some of the reasons why and offer this door-to-door testing. A combination of testing rate, a case rate, but also test positivity rates. So actually, Beanfield scores highest in terms of low testing rates, has particularly low testing rates. So in terms of your other question around what's the difference and why has Beanfield got higher case rates than other areas, it's not so much that it's got higher case rates, but it does have lower testing rates. And I think that will be something that will be really useful to explore when volunteers are going to door. They might be able to give us some feedback about what people are saying on the doorstep around why they might not be able to, why they might not be getting tested.
That's really helpful. Thank you ever so much. Kate Cronin, can I come to you, please?
Hello, afternoon. My question is, there's been extensive door-to-door election campaigning in Corby during the past week ahead of the forthcoming local elections. Has there been any formal direction given to candidates in the town, given the stubbornly high COVID rates? And does Lucy have a message for those candidates engaging in door-to-door canvassing?
Thanks, Kate. So I will take this one myself. The fact of the matter is that actually it is permitted by the current restrictions and regulations. And obviously our job is to make sure that activities that are permitted, we give guidance as to make sure that they are as safe as possible. So we have produced and circulated guidance to make sure that this is undertaken in as safe a way as possible. but at this point in time, it is obviously permitted by the current regulations. John Ironmonger from BBC Look East, shall I move on to you? Just realised he's not here, is he? I can't see that name. So what I will do is read them out in his absence. So it was to public health. So considering the high levels of positive tests in Corby, is it safe for the unlocking measures to take place on Monday? And what impact is that expected to have on rates in the following weeks? And they'd also like to know more about the current locations and settings of positive tests, whether workplaces, homes, schools, or any particular areas. Dr. Watt, are you happy for me to come to you first, just for a comment on sort of potential impact on Corby, and then I'll come to Dr. Harris for a bit of a follow-up on some settings.
Thank you, Lucy. So I think it is very much about people's enthusiasm to get back to normal. And I think that if we are not able to keep each other safe, that will impact on our ability to do that. So we all want our, the children to attend school. We want to be able to safely attend the supermarket. We want to be able to do all the things that are reasonable to do and to meet up with people outside in a safe manner. And if we have increasing rates of infection here, that's going to impair our ability to do that. So this is very much about being in control of our own destiny, making those decisions, accessing both the testing and the vaccination, and that is the way that this will have the biggest impact and allow us to get back to normal. So this is not so much about the change in the national rules, but actually we have the ability to influence what we do locally, build on the positive progress that we've made, look after each other, and make sure that we make as much progress as possible, despite being an extremely friendly town.
Thank you. Roslyn, shall I bring you in on the second part of that question?
Yeah, so the second part was around positive cases and whether they're mainly household cases or cases associated with workplaces or schools. So we're still seeing a picture, although that there are lots of cases that we're identifying in school-aged populations, that most of our cases are household clusters, so associated with households. As you'll have seen in the surveillance pack, actually the number of workplace outbreaks is fairly small that we have at the moment. So yeah, majority of any cluster of cases are cases that are transmitted within the household.
Thank you. And lastly, if we just move on to the global media questions, which we always read out. So panel's views, please, on the COVID passports, especially if the Silverstone Grand Prix could use it. I would welcome people's views. Obviously, it is something that is still a proposal. I know that obviously we are still waiting to find out what the potential results are of that being tested elsewhere. So, Roslyn or anybody else, would you like to come in and give a view?
Yeah, just to reiterate that, I guess, is that this proposal is being tested and piloted elsewhere. So I think we really need to understand how these passports could work practically, understand some of the challenges around monitoring that, and the impacts as well that has on controlling transmission around events before we proceed. And I guess understanding what the government's position is on this. So I think I would hold my judgment until we understand more about the results of pilots.
Thank you. I think from preliminary discussions, that was obviously most people's views. I think there's a lot to learn from where that is being tested elsewhere and in different settings. If I just read out that obviously we don't have a police representative with us, I'm not sure if we're able to read out a statement, but we're being asked, will there be extra police patrols around pub gardens and shopping centres? Katie, do you want to come in there?
Yes, hi Lucy. So we have separate police plans in place for the next step of lockdown easing. Around the reopening of shops, we're going to have our neighbourhood policing teams and the joint enforcement teams, which are run with our partners, They've worked to identify key areas for patrols, and we'll be working with shops to provide advice to ensure that they are COVID compliant once they reopen. And the second plan that we have in place covers the nighttime economy, so that's pubs and other licensed premises. And this is going to follow the work that we've done in policing in this area at the end of the previous lockdowns. So there will be extra staffing in place to ensure public safety and also to ensure good compliance from both the public and the licensed premises. We are also working with local authority licensing and environmental health officers, and that's to conduct joint visits to help premises ensure that they are compliant and support them with anybody in the business who is not complying with COVID regulations. So if there's anything to be supported with in that area. As ever, we would continue to encourage people to continue to follow the rules, obviously remain in those groups of 6 people or 2 households, and to comply with the rules that licensed premises have put in place to ensure that the spread of COVID is contained, because that's obviously going to support all the progress that we have made as a county, and make sure that that can continue.
That's brilliant. Thank you, Katie. And I appreciate you, obviously, as one of the communications team representatives, just making that statement on Simon's behalf in his absence.
No problem.
Was what's the one thing most concerning from a public health point of view about Monday? I'm going to take liberty as chair here and actually just say I don't think this is just a public health view. I mean, everybody on this panel has, lived, breathed, slept COVID for the last, year and a half almost. So I'd be really interested just to hear from the panel generally. So Eileen, you touched earlier on the fact that we've made positive progress, but what does it mean for you, the movement that we're making obviously on Monday?
So we all want to see the end of this, don't we? We're all desperate to get back to a little bit of normality, all of us on the panel, all of us on this call. And I think, make the best of it, but just be sensible. Hopefully, I mean, bizarre weather at the moment. I would say go outside but take a coat and a brolly and some snow boots if the last week is anything to go by. But, it's so important. We so want this, but we have to do it sensibly. Otherwise, we won't necessarily be back to square one, but it'll be difficult to see how we come out of this. And we've got 10,000 staff between these 2 hospitals, and they've been battling this all year, as have many colleagues. Honestly, I think everybody wants to see the back of it. So it's really, enjoy yourselves, but just be sensible, because actually, it's been hard going, I think, for everybody.
I couldn't agree more. Chris, from a vaccine perspective, what do you think it means?
I think we all know the strides to be made in the vaccination programme. We know the impressive uptake that we've seen in many of our age cohorts. But of course, that doesn't cover the entire population that will be subject to the new rules from Monday. And so whilst I said earlier, of course, please, if you've had your first vaccine, continue to take precautions, make sure you come to your second. It's an even stronger message for everyone else, for those under 50 that haven't yet been able to come forward in the JCVI cohorts, which is, yes, of course, lockdown is starting to be released very, very slowly, and there are new rules for us to follow, but please follow them carefully, please obey them, because the last thing that we want is for any return to some of the increased infection rates that we've seen in the past. That's the last thing any of us want. We know that's the last thing any of the public want. So please continue to work with us and support the good work that everyone has done so far, health staff as well as the general public, so that we can continue to make the progress that we've made so far.
Thank you. Jo, what does it mean from a primary care perspective as well?
I think I would urge people to be kind and to be considerate, and that not everybody is feeling as confident about coming out of this, and not to put pressure on people who are a little bit more cautious. And I certainly know that I've got patients who have not been out for a year and may not yet feel confident, and it's about being considerate to the people around you. Some people are desperate to get out, but also some people are a little bit more cautious. Some people are struggling with their mental health, and I would urge those who are struggling, please get help. Obviously, we have the mental health hub number, and really for any sort of healthcare, get some advice, call 111 if you need to access services, but continue to be kind to the people around you. In particular, frontline workers across our system have had a hard year. Everybody has had a really difficult year. Please continue to wear face coverings, be tolerant of the people around you. You don't know what sort of a year anybody has had. And I think it's about being considerate to each other, making sure that you look after your health needs, making sure that you remember that there are other conditions as well. So particularly some of the things that people have been ignoring over the last year, signs of cancer and things like that. Those things do need to be looked after, and actually we're not bothered with those things. We are happy for you to bother us in primary care if you think you have those serious conditions and you've been putting off that moment. But do seek advice so that you only go to those healthcare services where you need to. GP surgeries are open, they will see you when they need to. There's lots of telephone advice as well. But I think my overall message is be kind, be considerate, and be cautious.
Thank you. And I think obviously in light of information I'm sort of being fed live as well about communications, etc., that are now going to be permitted in light of the, as I said, sad death of His Royal Highness Prince Philip earlier today. I think I will call the press conference to an end at this point. Thank you all very much for attending. I appreciate there's lots of competing bits of information happening today, but obviously this is still a big concern and a big cause for us to make sure that we're cautious as we move forward, bearing in mind the changes on Monday. So thank you again for all dialing in. Have a good weekend, and we will see you in a couple of weeks. Thank you now. Bye-bye.
Thank you.